Let us talk about the therapeutic uses of steroids. Several semi-synthetic derivatives of corticosteroids are available. These agents vary in anti-inflammatory potency, mineralocorticoid activity, and duration of action. Corticosteroids are used in the replacement therapy and in the treatment of severe allergic reactions, asthma, rheumatic arthritis, other inflammatory disorders, and some cancers as well. So, we're going to be discussing their actions one by one. Steroids are used for replacement therapy for primary adrenocortical insufficiency, that is known as Addison disease. Addison disease is caused by adrenal cortex dysfunction as diagnosed by the lack of response to ACTH administration. Well, hydrocortisone, which is identical to natural cortisol, is given to correct the deficiency. Failure to do so may result in death. The dosage of hydrocortisone is divided so that 2/3 of the daily dose is given in the morning and 1/3 is given in the afternoon. The administration of fludrocortisone, a potent synthetic mineralocorticoid with some good glucocorticoid activity, may also be necessary supplement mineralocorticoid deficiency. Next is replacement therapy for secondary or tertiary adrenocortical insufficiency. These disorders are caused by a defect in CRH production by the hypothalamus in the ACTH production by the pituitary. So, under these conditions, the synthesis of mineralocorticoid in the adrenal cortex is less impaired than the glucocorticoid. And hydrocortisone is used for the treatment of these kind of deficiencies. Moving on, steroids are also used for the diagnosis of Cushing syndrome. So, Cushing syndrome is caused by hypersecretion of glucocorticoid, which is also known as hypercortisolism, that results from excessive release of ACTH by the anterior pituitary or an adrenal tumor. So, one thing to remember here is that chronic treatment with high doses of glucocorticoid is a frequent cause of iatrogenic Cushing syndrome. So, cortisol levels and the dexamethasone suppression test is used to diagnose Cushing syndrome. And the synthetic glucocorticoid dexamethasone suppresses cortisol release in normal individuals but not those with Cushing syndrome. It is also used for the replacement therapy for congenital adrenal hyperplasia. Well, CAH or congenital adrenal hyperplasia is a group of diseases resulting from an enzyme defect in the synthesis of one or more adrenal steroid hormones. So, CAH may lead to viralization in females due to overproduction of adrenal androgens. So, the treatment of the condition requires administration of sufficient corticosteroids to normalize normal levels by suppressing release of CRH. So, the choice of replacement hormone depends on the specific enzyme defect that has been occurring in adrenal cortex or adrenal medulla. The other use of corticosteroids is the relief of inflammatory symptoms. Corticosteroids significantly reduce the manifestation of inflammation associated with rheumatoid arthritis and inflammatory skin conditions including heat, redness, swelling, pain, tenderness, and loss of function. And it's going to be present on the site of inflammation. These agents are also important for maintenance of symptom control in persistent asthma as well as management of asthma exacerbations and all. And the drug of choice, you can say, is prednisolone or prednisolone over here. But corticosteroids are not curative in these disorders. Corticosteroids are also used in the treatment of allergies, and they're beneficial in the treatment of allergic rhinitis, especially, and as well as drug, serum, and transfusion allergic reactions. An important thing to note here is that allergic rhinitis and asthma, fluticasone and other are applied topically to the respiratory tract through inhalation, and beclomethasone inhalers are also used in it. So this minimizes systemic effects and allow the patient to reduce or eliminate the use of oral corticosteroids. And the last thing that it majorly does is acceleration of lung maturation. Well, respiratory distress syndrome is a problem in premature infants. Fetal cortisol is a regulator of lung maturation, but consequently in premature babies, a regime of betamethasone or dexamethasone administered intramuscularly to the mother within the 48 hours preceding premature delivery can accelerate the lung maturation in the fetus. So these are all the major therapeutic uses of corticosteroids.